You're listening to Med School Radio, bringing you the best in medicine. Welcome back to Med School Radio. This is Simon. I'm in Tokyo again. It's really nice to be with you guys again. What I'm doing here is I am reading something called Path Bites, which is an email that is written by Dr. Christine Krafts. I've been reading these emails for more than a year, actually, and I decided that I wanted to put them on the radio. So I've been making these. I've actually been recording them, and now I'm going to try and do them live and see how they sound, play some music in the background. Anyway, let's get going. Today we're going to talk about sarcoidosis. Turn the volume down just a little bit. Okay, sarc. Sarc is a prefix that pops up here and there. It's from the Greek sark, which means flesh. So sarcoid is something that looks like flesh, but isn't. And the granulomas of sarcoidosis do look kind of fleshy. And a sarcoma is a tumor of flesh, as opposed to a carcinoma, which is a tumor of things that cover or line the flesh. It's funny, I always hear sarcoidosis come up in Dr. House, MD, and I always wonder what it is. And it's really great to read this email and get this great explanation. So anyway, moving on. You can even see it in our regular non-medical language. Sarcophagus and sarcasm. I have no idea if that will help you remember what sarcoidosis is, but sometimes knowing the derivation of a term can help, Dr. Krafts says. So, sarcoidosis is a systemic disease characterized by granulomas in many different organs, and the most common site of involvement is the lung. Eye and skin are also frequently involved. The granulomas in sarcoidosis are non-caseating. Other things, like mycobacterial and fungal infections, can cause non-caseating granulomas too. So you have to rule those things out before you can make the diagnosis of sarcoidosis. The exact cause of sarcoidosis is not known, but it seems to be related to an abnormal immune reaction to some environmental agent. There seems to be a genetic predisposition to the disease. People with HLA-A1 and HLA-B8 appear to be more likely to develop it. It's the same annoying thing you'll hear over and over with immune diseases. The exact cause of the disease is not known, but it appears to occur in genetically predisposed patients following exposure to some unknown environmental agent. Anyway, to read more, please look at Robbins' 9th edition, page 693. So I hope you will come back and join me again as I read some more of these Path Bites, which are available on the website of Dr. Krafts, pathologystudent.com. And today we're listening to Simple Minds, Promise You a Miracle. We'll check back again, and thanks for tuning in.